About 2 million people in the UK have type 2 diabetes, and the figures are rising daily. Being overweight and living unhealthy lifestyles that include poor diet and lack of exercise are being blamed by doctors for this sharp rise in diabetes that dramatically increases your risk of coronary heart disease. 60-year-old Bill from South Devon was diagnosed as having diabetes 4 years ago. The news of his illness hit Bill hard, and he's been finding it difficult to adjust to his new lifestyle.
It knocks you for six. My life is different now since I've been diabetic because you've got to constantly monitor it every day. So you just can't say, right, I'm going to go for a 6-mile walk today. Well, it's an effort to walk around town. It's very hard to describe, really, to somebody how you feel. They look at you and they say there's nothing wrong with you. They can't physically see it, can they? So as far as people can see, you're walking along there and you're normal. As for exercises through the course of the day, no, it's not part of a routine at all. It's just pottering around, bit of gardening. I go down with the daughter to sort the horse out, you know. It's just things I enjoy doing, you know. It takes many years for it to come on, you know, like I mean, say, with the drinking and the smoking. It doesn't help, especially the drinking. I used to drink about 100 pints a week. That's a lot of beer. I spent about 10 years drinking like that. I think that's why I am diabetic, through heavy drinking. You can't turn the clock back.
Bill is 60, and the main thing that comes out here is he's got diabetes, got raised blood pressure and a raised cholesterol, all of which will put him at increased risk of heart disease in the future. But it's also the case that his diet could be improved and he doesn't take any physical exercise. So I wonder if the issue here is trying to get him motivated to improve his own lifestyle whilst the doctor can treat the blood pressure and the diabetes.
If, like Bill, you have diabetes, you may feel that it's sometimes difficult to exercise due to your fluctuating blood sugar levels and corresponding loss of energy. It is, however, vital that you do incorporate some exercise into your lifestyle, as this will help to control your diabetes and make you feel better, in addition to decreasing your weight and risk of heart disease. Finding the initial motivation to begin an exercise routine and knowing what exercise you will enjoy is sometimes hard. Local fitness coordinator Sandy Gilbert is one of many people throughout the UK who encourage people to get motivated and start exercising.
My job is about helping more people to be more active more often. It's really important for diabetics to get better control of their condition by diet and exercise because diabetics, unfortunately, have an increased risk of heart attack and stroke. I think a lot of people who are overweight or having problems exercise, they lack self-confidence. They have a perception that it's not for them, that exercise is for other people. I think Bill will probably be a little bit nervous. He hasn't seen me for a while. I'm sure he's got his reasons, but he does know fundamentally the importance of regular exercise. So I want to help him today. I want to help him to make a start.
I'm a little bit nervous. This is new experience for me at the moment now. I haven't done it for about maybe 5 years that I've gone really for a walk. I like to get down to at least about 13 stone. The doctor's quite happy if I lose 2 stone. You know, it takes that risk away from having heart attacks and strokes, you know. So I'm hoping to live a bit longer.
Hi, Bill.
Hi, Sandy.
How are
Nice
you?
to see you.
Nice to see you.
All
I
right.
haven't seen you in a long while.
No,
How are you doing?
Not too bad, thank you.
What we're going to do today, Bill, if you'd like to think about it, is to try a short walk.
Yeah.
What we're looking for is for you to get what's called comfortably breathless.
Right.
The recommendation is 30 minutes, but if you can't do the 30 minutes in one go, it doesn't matter. Just start with 10 minutes, as well as trying to help with your diabetes, the regular exercise.
Yeah.
Regular exercise can do a great deal to either maintain a healthy blood pressure or reduce a high blood pressure.
Following these words of encouragement from Sandy, Bill puts his nerves aside and takes up the challenge to join a Healthy Walks programme down at his local leisure centre.
Right, we've got group 1 who are going to do a half-hour walk. Lovely sunny day for it. I hope you'll enjoy it. So let's go. We walked mostly in the town because obviously around the country here it's a bit steep.
That's what I want to try and get doing, and I can do this every week as well.
Brilliant. So this is the warm-up bit to it. What we do, we start off nice and gently,
Yeah.
and then a little bit further on we may just make the pace a little bit faster. All right?
Okay. Can I have a drink a minute?
Okay. Do you want to stop at the next bench?
Yeah, I'll be okay. I'm surprised I've gone this far. I used to get out of breath just bending over, put my socks on. I can talk as well at the same time at the moment.
Stop here for a minute. Stop here, Bill. That's it. Keep your feet going, that's it. At this point, you can go back that way or you can continue with us. You want to go ahead? Okay, good. Okay, I better go onto the pavement, Bill, look.
I'm surprised myself what I'm doing, actually. It's an achievement, and I'm doing well. I've got a sweat on, but I feel absolutely wonderful. Yeah, I'll be coming back next week when it starts. Yes, I should do it every week.
It went really well. Did you see he got the hang of the feet? And no stick, I think that's important. He said he hasn't walked without a stick for a long, long time, because that's great for his balance and therefore for his confidence. So I've every expectation he'll go forward.
Getting active should be a gradual process. But after checking his blood sugar level and having a sit down, Sandy just wants to show Bill another option, the gym.
Come on over and we'll have a go on the exercise cycle. Start off on a light workload, and hopefully, if you enjoy it, you can come along in between other activity, in between your walking, or if the weather's bad. A lot of people have a perception that gyms are boring. It doesn't have to be boring. If you've got a motivational instructor, then you will be set goals, you will have some sociability, and also if the weather's bad, it's a great alternative to keep up your level of fitness. We've made a good start together, haven't we?
Okay.
That's great.
Thank you very
All the best.
much,
That's
Andy.
great. Fantastic.
Okay.
See you soon
Bye.
then. Bye.
Here's our top 5 tips for managing diabetes. Control your blood glucose. Aim to eat meals and check your blood glucose at regular times. Keep to a healthy weight. This will help to control your diabetes. Eat a healthy, balanced diet. Get active. Try to carry out 30 minutes of activity at least 5 times a week. Control your blood cholesterol and blood pressure. Talk to your doctor about lifestyle changes and medication.